Do you struggle to wear your shirt or comb your hair due to pain and stiffness in your shoulder joint? It might be due to a condition called as frozen shoulder. Through this video, let's see what is frozen shoulder and how we can manage it. Frozen shoulder is a condition in which the capsule and ligaments around your shoulder joint gets thickened and the movements in your shoulder joint gets restricted. Okay, let's then see what are the stages of this frozen shoulder. This frozen shoulder develops in 4 stages. The first stage is pre-freezing stage. This is the stage the patient doesn't show much symptoms but still they find it difficult to perform movement of their shoulder. And the second stage is called as the freezing stage. During this stage, the patient finds pain, severe pain around their shoulder, but still stiffness is not that profound. The third stage is the frozen stage. Here the pain decreases but the stiffness increases. And the last stage is the thawing stage. It usually occurs about 6 to 12 months after the frozen stage, and during this stage, this problem resolves on its own. How can we rule out that if a person is having frozen shoulder? There is a simple test called as the Apley's crutch test. We ask the patient to touch their back by 3 ways, like through this way, the first way, and through the second way, through the above the neck, and the third way by touching below the neck. If the person cannot touch their back in any of the 3 ways due to pain and stiffness, then we can rule out that the patient is having frozen shoulder. How we physios can manage frozen shoulder? Frozen shoulder can be managed by simple exercises like Codman exercise. This is a range of motion exercise which will help to reduce and to improve the range of motion in case of frozen shoulder. And the second one is band exercises. This exercise is done with a band and it helps to manage the frozen shoulder. The third one which we can do is like this wall walking exercise. Simply we can ask the patient to keep their hand and walk in the wall so that it will help to increase the range of motion. Along with that, we can give pain management through electrical modalities like TENS, IFT, ultrasound, and stretching exercises can be given so that we can stretch the stiffened capsule and strengthening of the rotator cuff muscles. The muscles around the shoulder, rotator cuff muscles, which we are strengthening, will help to improve the range of motion, and also further weakening of the capsules can be prevented by strengthening of the rotator cuff muscles. If the condition is more severe and still the patient didn't get resolved, then we can recommend the patient for a surgery so that they can get pain relief. Bye for now. Follow for more such interesting topics.